Your doctor checked your blood pressure. Your cholesterol came back normal. You left the clinic feeling fine. Here's the problem. Most people who have a stroke had a clean checkup first. Normal numbers do not mean safe vessels. The real warning was never in a blood test. It was in your body days before the disaster. 2. Credibility stake. According to the Global Burden of Disease Study 2021, published in The Lancet Neurology in September 2024, stroke now kills over 7 million people per year worldwide and disables tens of millions more. The World Stroke Organization's 2025 Global Fact Sheet confirms stroke remains the second leading cause of death among non-communicable diseases. Stroke-related deaths have risen 44% since 1990. That is not a stable problem. That is an accelerating one. 3. Dramatic stakes reveal. Here is what this video is going to show you. First, stroke is almost never sudden. In most cases, your brain sends out specific timed warnings hours or days before the event. You just were never taught to recognize them. Second, the most dangerous stroke warning signs do not feel like emergencies. They come and go in minutes. They feel like nothing. That is exactly what makes them lethal. Third, there are 3 clinical tests that can assess your real risk before a stroke happens. Most patients never ask for them. Most doctors never bring them up unless you do. By the end of this video, you will know all 3, and you will know what to do in the 72-hour window that follows a warning episode, which is the only window you for. The list. Warning sign 1. Temporary blindness in one eye. You are walking to the kitchen and one eye suddenly goes dark. Not blurry, dark. Like someone dropped a curtain over it. It lasts maybe 30 seconds, then it clears. You blink a few times, assume you stood up too fast, and forget about it by lunch. That episode has a name. Amaurosis fugax. It comes from Latin and means fleeting blindness. According to StatPearls, published by the National Center for Biotechnology Information, it is caused by a temporary drop in blood supply to the retina, most commonly because a small clot or fragment of arterial plaque broke off from the inner wall of your carotid artery and briefly blocked the retinal artery. The retinal artery is not isolated. It branches directly off the internal carotid artery, the same vessel that feeds your brain. A clot that lands in your eye today could land in a brain artery tomorrow. The Cleveland Clinic classifies amaurosis fugax as a medical emergency. Research indexed on PubMed estimates that 5 to 10% of people who experience this symptom will have a full stroke within the following year. Mayo Clinic data on carotid disease patients confirms that in a high percentage of cases, an ipsilateral carotid stenosis of over 50% is found after an episode like this. Neurologists treat that single symptom the same way a firefighter treats smoke. It means fire is somewhere nearby. If one eye goes dark and comes back, that is not relief. That is a warning you have not responded to yet. Warning. Sign 2. One-sided numbness or tingling. Your hand feels like cotton. Your face tingles on one side. Half your arm goes rubbery while you are just sitting still. It fades after a few minutes and you move on. The key detail is one side. The brain is organized so that the left hemisphere manages sensation for the right side of the body and the right hemisphere manages the left. When blood flow to one hemisphere drops, even briefly, the sensory map for the opposite side of the body glitches. You feel it as numbness, tingling, or a dead heaviness in one arm, one leg, or one half of the face. This is categorically different from sleeping on your arm. Nerve compression from posture resolves when you move and blood flow normalizes locally. A TIA-related numbness comes from inside the brain. It has nothing to do with how you were sitting. The American Stroke Association notes that sudden unilateral numbness is one of the 5 core stroke warning signs and always warrants urgent medical evaluation when it appears without a clear mechanical cause. Research published on the National Center for Biotechnology Information confirms that symmetrical numbness in both hands simultaneously is more often related to cervical spine compression than to stroke, but when it is one side, sudden and self-resolving within minutes, the stroke pathway needs to be ruled out before any other explanation is entertained. Warning sign 3. Sudden loss of coordination or violent dizziness. You are on flat ground. You know this floor well. And suddenly your foot lands wrong. You stagger. You grab the door frame, or the room starts spinning violently without any movement on your part. The cerebellum sits at the base of the skull. Its entire job is balance and smooth motor coordination. It receives its blood supply through the vertebrobasilar system, a network of arteries that run through the bones of your neck up into the back of your brain. When blood flow in those arteries is disrupted, even briefly, the cerebellum essentially freezes mid-calculation. You veer, you stumble, you feel like the floor shifted. According to the American Stroke Association, sudden difficulty walking, dizziness, and loss of balance are classified as core stroke warning signs. The clinical distinction that matters is this: dizziness with a clear trigger, rolling over in bed, turning your head quickly, or a known inner ear condition is usually benign. Spontaneous, intense dizziness with any balance disruption and no obvious trigger is a different category entirely. The WHO includes sudden difficulty with walking or loss of balance in its official list of stroke warning signs. If it happened once without explanation, that is reason enough to have a vascular workup. Not next month, that week. Warning sign 4. Speech breakdown. Suddenly, you cannot get the words out. You know what you want to say. You can hear the sentence in your head. But what comes out is slurred or chopped or just not there. Or the opposite happens. You speak fluently, but what you say makes no sense, and someone else has to tell you that. The brain has two main speech zones, both typically in the left hemisphere. Broca's area handles word production and coordinates the muscles of your tongue, lips, and jaw. Wernicke's area handles language comprehension and sentence organization. When either zone loses blood supply, even temporarily, speech breaks down in those specific ways. The National Institute of Neurological Disorders and Stroke, part of the National Institutes of Health, confirms that sudden trouble speaking or understanding speech is one of the primary warning signs of stroke and TIA. The American Stroke Association uses the FAST acronym face, arms, speech, time, with speech as one of the 3 core warning signs requiring emergency response. The detail people miss is the word suddenly. Forgetting a name when you are tired is not a warning sign. Speech that collapses without warning and then recovers in minutes is a completely different event. The self-correction does not make it less serious. A fire alarm that stops ringing does not mean there was no fire. Warning. Sign 5. Autoimmune skin changes combined with new, unusual headaches. This one surprises people. It is not dramatic. It is a pattern. Vitiligo is a condition where patches of skin lose pigment because the immune system attacks the melanocytes responsible for skin color. It is an autoimmune process. The immune system misidentifies its own tissue as foreign and attacks it. The problem is that autoimmune activity rarely stays contained. Research indexed on PubMed shows that the same immune process that attacks melanocytes can also inflame the endothelium, the thin cellular lining on the inside of every artery in your body. The endothelium is not just a passive tube. It actively regulates blood flow, prevents clotting, and keeps artery walls smooth and flexible. When chronic inflammation damages it, the surface becomes rough. According to research from Harvard Medical School on endothelial function, damaged endothelium loses its capacity for healthy vasodilation and becomes a surface where LDL cholesterol, platelets, and inflammatory proteins accumulate. That is how plaques start. Vitiligo alone does not predict stroke. But vitiligo combined with new headaches that differ from your usual pattern, meaning more frequent, more intense, or different in location, is a combination that warrants vascular evaluation rather than a watch-and-wait approach. The WHO and major cardiology bodies recommend investigating any new headache pattern in the context of known vascular or autoimmune risk factors. Your headaches may be unrelated, but the combination is specific enough to mention to your doctor directly. 5. Promised secret climax. Here is what nobody tells you clearly enough, and it is the most important thing in this video. After a warning episode, you have roughly 72 hours. That is your window. Not 72 hours to think about calling your doctor, 72 hours where intervention can still prevent the full event. Most people waste that window because the symptom went away. It felt like a false alarm, but the symptom going away is not the same as the problem going away. The carotid plaque is still there. The clot risk is still elevated. The vessel is still narrowed. There are 3 tests that can assess your real stroke risk right now. A carotid duplex ultrasound shows both the anatomy of your neck arteries and the actual blood flow through them. A glycated hemoglobin, or HbA1c test, reveals your average blood sugar over the past 3 months, which is the number that reflects silent endothelial damage, not the fasting glucose you check the morning of a blood draw. And a 24-hour Holter monitor records your heart rhythm across an entire day. It catches atrial fibrillation, which is the hidden arrhythmia that triples stroke risk. Anticoagulants, when correctly prescribed for atrial fibrillation, reduce stroke risk by 60 to 70% according to multiple peer-reviewed analyses. The warning came. The question is whether you use it. 6. Soft Sales/Authority, CTA. If any of the 5 warning signs appeared in your life, even once, even months ago, write them down in plain language and bring that list to your next appointment. Ask your doctor directly whether a carotid ultrasound, an HbA1c, or a Holter monitor makes sense in your specific situation. Do not leave with everything looks fine. Leave with actual numbers and an actual plan. If this video gave you something concrete to act on, subscribe and hit like so we can keep making content that treats you like an adult with a brain worth protecting. Now watch this next. It covers the one number on your blood panel that predicts a stroke years before any symptom appears, and most doctors never explain it.